Hello, everyone, and welcome back to Youthful Medicine, a channel where I talk about autoimmunity, obesity, and anti aging to help you live a life full of youthfulness, vitality, and to aim for longevity. I am a board certified rheumatologist, a board certified obesity medicine doctor, and this YouTube channel is separate from my medical practices. This channel is purely for public education, and if you are seeking a medical advice, please consult a doctor that can take care of your health. Please use this information only for education purposes. Today, I will be discussing with you a case of ankylosing spondylitis patient who has chronic fibromyalgia and recently developed a chronic kidney disease. Well, here is what is happening with patients. When somebody has an autoimmune condition such as ankylosing spondylitis, they are in chronic pain, which is there all the time. This pain is present when they wake up in the morning. They are stiff like a board. It is hard for them to get out of the bed and walk. They usually have stiffness of their neck. They have difficulty rotating their neck. They have difficulty with their SI joints and their lumbar spine, lower back. Now, these patients, to help relieve the inflammation, take medications such as Advil or Aleve and anti-inflammatory medications, which can cause problems, but at the same time relieve inflammation. So this patient presented to me with evaluation for ankylosing spondylitis several months ago. At that time, the patient had typical symptoms of chronic ankylosing spondylitis. She is a mid 40-year-old female who had at least 10 years of back pain, stiffness, and SI joint pain and tenderness. So remember that when people have ankylosing spondylitis, they may have symptoms for many years, which they attribute to back pain due to lifting weights or having something to do with injury, accidents. But remember, if you are waking up every day in the morning after a prolonged period of inactivity, you wake up with stiffness and pain in your lower back or in your upper back neck area, SI joints area, you should seek medical advice. So this patient had these symptoms. We did further diagnostic workup. She was HLA-B27 positive. She also had imaging to show that MRI to show that she had sacroiliac joint inflammation. Now, she has completed her family, and when I discussed about the medication I recommended her was called sulfasalazine, which is a disease-modifying anti-rheumatic drug. Not the most effective medication, but we start with that to see if patient can benefit it. But in reality, biologic agents are usually the most effective ones. We had a couple of follow-up visits. She had some improvement, about 20-30% in pain. Her inflammatory markers were still elevated, but they are moving down. So today, I would like to dive deeper into the encounter that we had. So on these labs, we discussed, how is her white count, how is her red blood cell count, how is her kidney function, how is her liver function. Well, all of those things were stable on sulfasalazine dose of 500 milligrams twice a day, but we saw an elevated kidney function. Now, it's indication that there is some injury to the kidney that happens. Now, we have to differentiate if the kidney disease is because of the disease or because of the medications. Is it because of dehydration? So in this case, what I suggested is I went over a list of her medication, and she had been given a medication called Celebrex, which is an anti-inflammatory, but if used constantly can cause kidney disease. So since she was still having pain and joint pain stiffness, she was using it, and I advised her to stop the Celebrex because this could lead to further kidney damage. And at this point, we can probably reverse the kidney disease if we stop the medication. That's why it's important that we check our patients' labs every 8 to 10 weeks and see them every 3 months. Because this has just happened between the two visits. The kidney function is not very elevated, 1.2. And if we stop the medication, we can easily improve it. I'm sorry, I think I used the word chronic kidney disease initially. It should be acute kidney disease. Now, Um, what other labs did I check? Well, I saw that she had elevated C-reactive protein. The C-reactive protein is a marker of inflammation. She had mild elevation of SED rate also. These two markers are commonly seen in autoimmune diseases, and they were elevated. So I told her that we need to work on inflammation reduction. I always talk to patients about gut microbiome to improve their gut health, probiotics, getting rid of processed foods. But at this point, since she still has persistent inflammation and numbers are, and she is in pain, I discussed about the opportunity to start a medication. We started the treatment with disease-modifying anti-rheumatic drug, sulfasalazine. Now it's a point to add a biologic therapy. And biologic therapies are really cutting-edge concepts of treatments. They are small molecules. They go and target the inflammatory cytokines, the chemicals that are released as a result of inflammation. You can treat somebody with anti-TNF agents like Humira or Enbrel, Remicade, Simponi, Cimzia, or you could also use oral agents like Xeljanz. I discussed with her about the medications that can be used for a patient who has ankylosing spondylitis. So at the moment, the question that we have to answer is, well, what are the current approved medications for patients who are diagnosed with ankylosing spondylitis? So currently FDA approved ankylosing spondylitis treatments include tumor necrosis factor medications, which include Humira, Cimzia, Enbrel, Simponi, Remicade. And then the second class of medication is called interleukin-17 inhibitors. One of them medication is called Cosentyx, and one is called TALTZ, T-A-L-T-Z. Then there are oral biologic agents. They are called Janus kinase or JAK kinase or JAK inhibitors. Xeljanz is an oral agent, and Rinvoq is another oral agent with this. So these are currently FDA-approved medications for it. So I discussed with her the opportunity to use these medications, and my patient opted for Xeljanz, which is a medication taken orally, 11 milligrams, extended release once a day, which works along with sulfasalazine and helps improve symptoms. This patient also has fibromyalgia, so I continued her use of Gabapentin, which she is using along with lifestyle changes that I usually recommend my patients, including yoga, improved sleep, and anti-inflammatory diet. She is also on vitamin D prescription because she has chronic vitamin D deficiency. Because of her location where she lives, she doesn't get enough sunlight. So the takeaway message are that the personalized approach for patient is important with autoimmune diseases. Management of labs is important. Change of therapy is sometimes important, and also helping them in a multifaceted approach where their diet lifestyle can be helped. So this is something that you can expect from a rheumatologist who will be taking care of you, and you should be aware of these things that can happen so that you are more actively participant in your treatment. I hope you found this useful. My Youthful channel is there for you for better education on autoimmunity, obesity, inflammation. And if you like this topic, like this video, please like it, subscribe to my channel, and share it with someone who might find it useful as well. And I hope that you stay youthful and healthy until your next visit with me on this channel, and I'll see you next time.